Revalidation for doctors who are retired and don't do any clinical practice. This video explains the process of revalidation for doctors who are retired, don't do any clinical practice but want to hold their license. From http://www.fph.org.uk/. If you want to continue to hold a license to practice, you will need to revalidate based on annual appraisal, like every other licensed doctor. If you don't carry out any clinical practice, then you may not need a license to practice. If this is the case, you can give up your license but maintain your registration. This will show you remain in good standing with the GMC. You can restore your license if you need it at some point in the future if your circumstances change. Please remember, though, that without a license to practice you will not be able to exercise any of the privileges conferred by it. These include writing prescriptions and signing death or cremation certificates. If you decide to give up your license, go to your GMC Online account and follow the guidance. If you don't have a GMC Online account, you can set one up at www.gmc-uk.org/GMCOnline. More information about giving up and restoring your license is also available at www.gmc-uk.org/relinquish. You will need to provide robust evidence annually, to show that you are up to date and fit to practice. You can read more about how to revalidate without a recommendation at www.gmc-uk.org/suitable_none. In summary, you will need to have a regular appraisal, from a licensed doctor trained in medical appraisal in the UK, based on our good medical practice framework for appraisal and revalidation. If you are unable to arrange your appraisal through an employer, you will need to make arrangements yourself, through an independent provider of UK medical appraisals. Every year, you will need to complete and submit a revalidation annual submission form to give us evidence of your practice, your participation in regular appraisal and your continuous engagement revalidation. You will also need to give us statements about your health, probity, and fitness to practice, as well as evidence of your good standing with any regulatory body outside the UK with which you have been registered in the last 12 months. You will need to take part in an independent two-part assessment of your medical knowledge and skills, if we ask you to do so. This assessment is designed to evaluate your ability to practice medicine safely in the UK. If you do not pass the assessment, we will investigate further whether you are fit to practice. This means your registration as well as your license will be at risk. You will need to pay a fee to evaluate your revalidation annual submission, and for each part of the assessment. From http://www.fph.org.uk/frequently_asked_on_GMC_revalidation. For further information and support for a doctor appraisal, please visit Medical Appraisals, http://medicalappraisals.org.uk.